Okay, so this is chapter 1, Anatomy Basics. We're going to cover organization of the body, major themes of anatomy and physiology, and then just like a general overview of anatomical terminology. So before we go any further, let's talk about what is anatomy and what is physiology. So anatomy is the study of structure, specifically the body. So anatomy is what makes physiology possible. Without anatomy, we don't have any physiology. We have to have a structure in order to have a function, which leads us into physiology, which is study of the function. Physiology provides meaning to anatomy. So without a function, there really isn't a purpose for the structure. So the two go hand in hand, and we study them together because you need function to have a purpose for structure, and you need structure to have a purpose for function. So there are numerous ways that we can examine the human body. Many of these ways are things that are done clinically. So first we have inspection, which we're just looking at it, inspecting it with our eyes. We're not touching, we're not feeling, we're just looking. Palpation is feel. When you touch, when you push, anything like that is palpating. Auscultation is listening to sounds produced by the body. Typically, we do this with a stethoscope. Percussion is when we tap on the body and we feel for things like resistance or any sound abnormalities. If something sounds hollow or full, we can also use percussion for testing to see if there's any tenderness in an area where there should not be. When we tap and things inside kind of move a little. Dissection, which it's obvious, you cut something open and you look at the insides of it. Typically in anatomy, we dissect things that are really, really close to human bodies, such as pigs, sheeps, or cadavers, which are actual dead human bodies. Cadavers are the best because it's the real deal, but pig and sheep are very, very close anatomical relatives to the human body. We have comparative anatomy, is when we look at different types of species and study their form and function and compare it with ours. A lot of this is done with things like monkeys, especially in clinical trials or medication trials, drug trials, especially in the past. We've used animals, monkeys, lab rats, things like that, and we've done procedures on them, given them medications, and then looked at their anatomy and compared it to ours and seen the changes and effects it had on them. And then you kind of see like what would it do if we put it in the human body. So that is comparative anatomy. You're comparing the human body to a different species body. Exploratory surgery is just what it sounds like. You literally go in and explore during surgery. This happens a lot when we don't know what we're looking for. We don't know what's going on. So we have to go in and figure it out. This can be replaced in some situations by medical imaging, x-rays, CT scans, MRIs, sonography. All these things can be used to see inside the body without actually going inside of the body. However, sometimes we still need to do exploratory surgery because we are limited in our views when we use medical imaging. They're not 100% accurate and they don't show everything. Radiology, it's another type of medical imaging, x-rays basically. We use these to see dense structures inside the body, specifically bones. And then we have comparative physiology, which is very similar to comparative anatomy, but it is comparing the function of different species organs to ours and learning from them. Well, if this animal's heart functions this way, does ours have a similar purpose or functionality? Or if this animal's body reacts to this way, will ours do the same? So we study other things because you don't always want to study humans. If you need to cut somebody open to study it, we always can't just cut people open and look inside of them. So we use a comparative anatomy and physiology to learn a lot, especially way back when medicine was first starting and we first figured out how the body was working and that there were organs inside. A lot of comparative anatomy and physiology were used to figure out which parts did what and where they were. Okay, Within the human body, there is a hierarchy of organization, starting from the smallest thing up to the largest thing, which is the whole human. So we're going to start at the bottom and work our way up. The smallest particle that is in your body are atoms, which make up molecules. Molecules make up things like water and other electrolytes and anything else that's in our body. These molecules can connect and form things and make up organelles. Organelles are parts of cells, the functioning parts of cells. So within a cell, there are little parts that do things, that have jobs. Those are the organelles. The organelles together make up a cell. A cell is the smallest unit of life. So a cell is living and it's functioning all within itself on its own, and it is living. Organelles and molecules are not living, a cell is. Okay, so we have a bunch of cells and they can come together and they can form tissues. There are different types of tissues. They can make bone tissues, skin tissues, heart tissues. So these cells, depending on what types of cell they are, come together and they make tissues. Tissues then come together and make organs. Again, it all depends on what type of tissue it is. Depends on what kind of organ. So if we have cardiac tissue, which is heart tissue, they would come together to form the heart. If you had esophageal tissue, that's tissue that is in your esophagus or your throat where the food goes down, that would come together to make your esophagus. So depending on the type of tissues, organs are made. And then organs come together in a system to make an organ system. So it's certain organs that work together form an organ system. For instance, the right and left lung and your trachea come together and they make your respiratory system. Your heart and the blood vessels come together to form your circulatory system. So certain organ systems come together. And when you have all of the organ systems in place and they are all working together, you make an organism, which the organism in our situation here for anatomy is the human body. So you start from small molecules and atoms and work your way all the way up to the whole body. There is a structure of organization, and it is in order from smallest to largest, most simple to most complex. Obviously, the entire human body is going to be more complex than one cell, because within the human body, there are billions and billions of cells, so it's going to be much more complex. Continuing on with our hierarchy of the body, the most complex thing at the very top of the hierarchy is an organism, which is the whole human. Next, we have the organ system, which is a group of organs that work together for a specific function or functions. Some systems have more than one function. Within the organ system, we have organs, which is the next thing down the list. These structures are composed of two or more types of tissue that work together to carry out a specific function. An organ has very defined anatomical boundaries. So it is very, very clear what organ this is, where it starts, where it ends, the inside, the outside. It's very, very clear. You can have organs inside of other organs. And we will talk about this when we get to some systems. So it is very important that we have defined boundaries so we know where one organ starts and the other one ends. Within the organs are tissues. Tissues make up organs. They're similar cells or products of cells that form to make an organ and give it its specific function. Different types of tissues make different organs because different types of tissues can perform different functions. It's very important that tissues that are carrying blood through the body can carry the blood through the body, where it's not as important for those tissues to be very, very strong and structurally protective like bone tissue. So certain types of tissues have different functions, and those functions lead to which kind of organs they can make. Tissues are made of cells, which again is the smallest unit of life. It can carry out all basic functions of life. It is considered living. And inside the cells, the working parts of the cell that carry out functions are organelles. Every cell has organelles within them, whether it's their energy-producing mitochondria, their photosynthesis, completing chloroplast, the protein-making ribosomes. Every organelle has a function within the cell. Inside of the organelles are molecules, which a molecule we'll talk about next week in depth is two or more atoms combined together. Okay, so the largest molecules that are in our body are proteins, fats, DNAs, those type of things. They are called macromolecules, macro meaning large. And we'll talk about those next week when we talk about chemistry. But there are many molecules within our body that are very, very important for carrying out the functions that we need to live. And then the smallest thing is an atom, which is the smallest unit of matter. Everything is made of atoms. So it's the smallest particle that we can literally make anything out of. And we do have them in our body. Even though we're made of cells, we still have atoms within our body. Okay, let's discuss anatomical variation and why this is important to learn and why it is clinically important. So anatomical variation is just what it sounds like. It is variations in anatomy. So no two humans are ever going to be exactly alike anatomically. Okay, even identical twins are going to have some differences. Okay, so you can get differences in many different ways. You can be born with the differences. Something can happen to you in life. You can get sick. You can get hurt. You can have a mutation before you're born. There are many ways to get these differences, but it's very important to be aware that there can be differences, and we should always verify that there are not differences before we do anything. So in anatomy books, when we see the human body, it shows the most common organization of structures or the normal organization of structures. Okay, so in some situations, there can be things where certain people lack muscles. People have different number of vertebrae. People have atypical organs or a typical number of organs, meaning they're missing organs, they have extra organs, the organs are in the wrong place, they're shaped wrong, they're small, they're large. There's a lot of variations that can happen with that. And then there are also people who have reversal of organ placement. So the left side of their torso organs, their heart, their lung, their stomach, or everything over there is on the right side where it should not be. And the right side is where the left side is. So it's very important to be aware that there can be differences in anatomy and make sure that we are checking on these things and verifying that this patient's heart is really on the left side of their body where it's supposed to be, because this can cause a lot of issues in clinical situations, in treating a patient, taking care of a patient, diagnosing a patient, any of those things. Not knowing where their organs are or if they're missing certain parts of their body can lead to other issues. Here are a few examples of anatomical variation. So you can see in the first image, we have a person that is missing part of their leg. So this person has had an above the knee amputation. We don't know why. They could have had an injury. They could have had sepsis. They could have had gangrene. They could have had anything happen. But for some reason, the doctor thought that it was the best practice to amputate their leg above the knee. So this person's anatomy in their right leg is going to be different than what the books show, or than what they should have. So when treating a patient like this or taking care of a patient like this, we need to be aware that they are missing majority of their right leg, all of the lower and the whole knee. So that's going to change a lot of things about this person. Then you have next to that a person that has their organs are shaped differently. There is the regular intestines, and there's a U-shaped intestine, a twisted intestine, and a V-shaped intestine. So it's very important to understand if our patients have different shaped intestines, because they could display things differently than a patient that has normal shaped intestines. So if a person is having pain in their intestines and we're not aware that their intestines are in a different place than they should be, we might mistake their pain for something else. So it's very important to be aware that, hey, their intestines are lower or they're higher or they're to the left, whatever it might be, to make sure that clinically we are understanding what the patient is telling us or what we are seeing. And then there is a heart that has had a bypass. So a bypass surgery is when they go in and they take veins from typically the legs and they place them in the heart to bypass arteries that are clogged and the blood can no longer flow through. So this person's heart that has had a bypass is going to look different from a heart that has not had one. They're going to have different arteries and in different places because the original ones don't work anymore. They're clogged. The blood can't flow. So we need to be aware that someone's had a bypass. And then this last picture is of an infant's hand that was born with syndactyly, which is when their fingers are not spaced out like they should be. They don't have 5 individual fingers. Some of them are fused, and the situation depends on the child. They could be 2 fingers fused, 3 fingers fused, 4, 5. They might only have 2 that are completely fused because the bones are fused. It just depends on the severity of the fusing. But these are all different types of anatomical variations that we need to be aware of when we are studying anatomy and we are taking care of people, because all these things can happen, and it's just important to be aware of, hey, I could end up having a patient come in that has a totally different situation than I am used to, and you have to be accepting of it and keep your mind open that it is very, very possible. Along with anatomical variation comes physiological variation. So anatomical variation is not as common as physiological variation. You're less likely to find somebody with an anatomical defect or an anatomical change than you are to find someone that has a change in the physiology. So things can change physiologically naturally, just based on age, diet, weight, physical activity, and even gender. Okay, genetics and environment can also play a huge role in the physiology of our bodies. So we need to make sure that we are aware that somebody's physiology, meaning the function of an organ, could be different just based on their age or their weight or any other health issues or comorbidities that they might have. So typical physiological values that can change. So a 22-year-old male that is 154 pounds that performs light physical activity every day and consumes 2,800 kilocalories a day would not have the same physiological values and processes in their body as a woman that is 128 pounds and takes in 2,000 kilocalories a day and has everything else the same. So obviously, the 154-pound man is probably going to burn more calories. His cells are going to process more. He's going to pump more blood. He's going to need to produce more oxygen. If he's eating more, his digestive system is going to work more than the woman who's 128 pounds. So we need to be aware that things vary from person to person, and it's not as rare as the anatomical variation. When you're treating a child versus a teen versus an adult versus an old person, there's going to be great physiological variation between them. Failure to consider the difference in the variations physiologically can lead to over-medicating people or under-medicating people, because women you typically need less medications than men, because men have higher metabolism. They will metabolize the meds faster. And especially elderly and children, they metabolize much slower than adults. So being aware that their livers work slower or their digestive system works slower will help us treat them better and make sure we're not over-medicating or doing anything like that, because we're not aware that there are changes in the physiological aspects of their body just based on age, gender, size, any of those things. Moving on, we're going to get out of anatomy for a second and go back to basic science, and we're going to talk about the scientific method and why it's very important in every branch of science, but specifically anatomy, and why it is really important clinically. Okay, the scientific method, I'm sure everybody has heard of it. You were probably taught this in elementary school, middle school, high school, every year, every science class, but it is really important. And whether you think you use it or not, you use the scientific method every day in your life. So the scientific method is a process of performing science, including careful observation, logical thinking, and proper analysis of observations and conclusions. So basically, it's this process of looking at things, thinking about them, and analyzing them based on what you see or what you have figured out. So science and scientific methods set standards for truth. In science, we're always seeking the truth and the why behind everything. We're not looking for this off the wall theory of this could happen because of this and this and this. We really don't care about that. We want to know the why in the absolute truth. So the steps of the scientific method include asking a question. The first thing should always be a question. Or you're like, hey, how does this work? Or what does this do? Or what if I did this? You always start with a question. In clinical significance, the question is usually, what's wrong with my patient? Why are they hurting? Why is this not working? You always start with a question. Second, you're going to form a hypothesis. So the hypothesis is your logical prediction of what you think is happening, going to happen, causing this. So for instance, why is my light not working? That's your question. Your hypothesis could be, well, my bulb is burnt out, my power is off, or the wiring is bad. Any of those logical explanations that you could come up with would be your hypothesis. The next thing you're going to do is perform an experiment. So in our situation with the light bulb, I'd go over and take the light bulb out, maybe put a new light bulb in. Or go check and see if the breaker was flipped, if the power was out, or if someone, flipped the breaker. Check other lights to see if the whole power is out in the whole house. Whatever it might be, you're going to go perform your experiment. Your next thing is going to be analyzing your data. So for every little step of your experiment, you're going to look at the results and take note. Okay, I put the new light bulb in, but the light still doesn't work. So it must not be a burnt out light bulb. Then you move on to your next step, and your next step, and your next step. And your conclusion is going to be what you collect at the end from the data. So if I put a new light bulb in and it did not work, then I know one of my conclusions is not burnt out light bulb. Okay, if I went in the garage and the breaker was flipped, then my conclusion would be breaker was flipped. I would flip it back on. Now the light bulb works. So those are the steps that you're going to go through. You're going to ask your question. You're going to form your hypothesis. You're going to perform your experiment. Look at all the data that you have from your experiment. Collect it, analyze it, and from that data, you're going to form a conclusion. So let's take the scientific method into the clinical scenario. So a patient presents to the ER with pain to the right lower abdominal quadrant. Their right lower quadrant, which is right of the belly button going down near the groin. Okay, they also have nausea, vomiting, and an elevated temperature of 103. Onset or start of symptoms was approximately 4 hours ago per the patient. So the first thing we're going to do is ask a question. In this situation, your question should be, what is wrong with my patient, right? They're hurting, they have a fever, they're nauseous, they're vomiting, something's not right. So in my head, my question is, what's wrong? Okay, so I'm going to form a hypothesis. Remember, the hypothesis is an educated prediction. I'm not just bouncing thoughts off the walls and saying, oh, they probably broke their leg. No, I'm using my knowledge and my education to determine what I think is wrong with them. So in my head, I'm thinking right lower quadrant. Okay, this could be the appendix. This could be the colon. This could be a hernia. Okay, what is in that right lower quadrant that could be causing pain? I know there's an intestine down there. There's also hip bones. There's also abdominal muscles. Okay, there's a bunch of things down there that could be causing pain. So you're going to start asking yourself questions to form this hypothesis. Okay, if I know these organs are down there, what else causes nausea and vomiting? Okay, so does a hernia typically cause nausea and vomiting? No. Does appendicitis typically cause nausea and vomiting? Yes. So I'm going to form the hypothesis that this patient has appendicitis. Then I'm going to go to my experiment. Well, how do we determine if a patient has appendicitis? We're not just going to put them in the lab and start dissecting them. We're going to do things where we can try and see inside of their body. Let's order some CT scans because that's the best way to see things. Or an abdominal ultrasound. Okay, an ultrasound of the appendix specifically in the bowel, the large intestine. We want to see what's going on in there. Okay, after we get those findings, we can analyze the data. We can look at that and say, oh, their appendix is really, really large. It's definitely inflated, and come to all these conclusions because of the experiments we already conducted. Remember, medical imaging, drawing labs, palpating, auscultation, percussion, all of those things are part of collecting data, which are part of the experiment process. We get all these data collected, and then we put them together and we look and say, okay, from the labs and from the CTs, this patient has appendicitis. That's our conclusion. Okay, we present that to the doctor. The doctor says yes, they have appendicitis, and then they go for the surgery, take the appendix out, and the patient's fine. But if you look at the way this patient was addressed from the time they came into the ER to the time they were diagnosed by the physician, the scientific method was followed. So you need to be aware that this method is definitely something that you're going to utilize, whether you think you're using it or not. Most of the times when we're problem solving in our life, we are using the scientific method. The inductive method is part of the scientific method, and it's a process where you make lots and lots of observations until you become confident in making predictions. So the inductive method is like practice till you like get perfect at it, basically. So we're going to look at things all the time until we become confident that we know what we are doing. So an example for you would be a radiologist, a doctor that looks at x-rays. A radiologist is going to spend years and years and years training to be a radiologist by looking at x-rays, reading x-rays, looking for specific things on x-rays, and identifying different aspects of x-rays before they're actually going to practice as a radiologist, because they're not confident in the very beginning. They got to practice and practice and practice. So looking at it for a very long time will help you become more confident in making those predictions and generalizations about what you see. So it's the practice makes perfect method. Anatomy knowledge was actually obtained by this method. It took hundreds and hundreds and hundreds of years for anybody to even figure things out about the body. They started studying the body like thousands of years ago, but even in recent medicine, the last 50 years, we have made great strides. So just looking at things over and over again until we become confident in it is very common in anatomy and in medicine in general. So in science, we need proof. Like I said before, science is seeking the absolute truth. So if we want the absolute truth, we need proof of it. So proof in science are reliable observations that can be repeatedly confirmed. Okay, and they can also not be falsified. So let's talk about something that is completely, we know 100%, gravity. We know gravity exists. We know how it works. What goes up must come down, right? So every time we throw something up in the air, except for gas. Gas has its own properties. But every time we throw something up in the air, I'm going to throw a shoe up in the air 100 times. It's going to fall every time. So I can reliably see that it's falling, and I can repeat it over and over and over and over again. This is proof in science, okay? It can also not be falsified by any credible observation. Credible is the key. People can go on the internet and claim that they falsified it, but you got to be credible. And in order to be falsified, it also needs to be falsified repeatedly. So in science, all truth is tentative, meaning we need proof beyond a reasonable doubt. And if we find a new truth today, yesterday's truth is out the door, and tomorrow's truth can get rid of today's truth. Meaning science is always changing. We are always finding new things. We are always improving on our science. It's always getting better. So if we think today Pluto is a planet, tomorrow Pluto is not a planet. Things change because we found more information that disproves that it was a planet. So just be aware that science is always changing. Medicine is always changing. Anatomy is going to always change because we're going to find better ways or more descriptive ways to talk about things. Falsifiability is if we claim something is scientifically true, we must be able to specify what evidence it would take to prove it wrong. So in order to say something is 100% true, you have to be able to tell me this would prove it wrong. So that is falsifiability in science. Continuing on with the scientific method, we're going to talk about experimental design. There are many elements in designing your experiment. So first, you need to think about your sample size. When you're setting up an experiment, you need to think about how many people am I going to study on, or how many subjects am I going to do this experiment on. Next, you're going to have different groups. So you're going to have a treatment group. This is the group that gets the treatment. So if you are doing a trial on does this cholesterol medication really work, the people that are actually getting the cholesterol medication are your treatment group. Okay, then we're going to compare them to a group that never got the cholesterol medication. That's going to be your control group. The control group doesn't receive any treatment, doesn't receive any changes. We don't do any experiment on them. We just kind of monitor them how they are. We don't touch them. We don't do anything. They're just there. They're the control. Okay, so then there are things like experimenter bias. So if the experimenter is biased on anything, likes this better than this, it can skew your results. So we don't want any skewed results in science. We want everything to be fact. If I am doing an experiment and I know that I'm taking a weight loss drug and I want to prove that it works, I could go cut my calories, I could go work out, I could go do any of that stuff. And that's going to skew my results for what the drug can do. So we want to make sure that there is no bias for the experimenter. So we do this by not letting the person in the experiment know if they are in the test group, the treatment group, or the control group. That is called a double-blind method. Nobody knows whether they're getting the meds or not. Okay? Then there is also the placebo effect, where people think they are having changes, but they're really not. So when we're doing an experiment with placebos, we have two groups. One group gets a pill, one group gets another pill. One pill is the actual medication, and one pill is just a sugar pill, a fake pill. But the people getting that fake pill might think that they're having results. That is called the placebo effect. So this affects their state of mind or even their physiology, because the mind can play tricks on the body and make you think things are happening that are not, and actually make the body do things. So this can be tested by giving the placebo to the group and seeing if they have any reaction or response to it. We can also use statistical tests to provide statements of probability whether the treatment was effective or not. So we can take surveys of everybody and take all this data and put it together statistically and figure out, well, does this work better than this, or does this work, or this doesn't, and so forth. A little more science lingo for you. Facts, laws, and theories. So in science, we have facts, laws, and theories. And they are not the same as facts, laws, and theories in everyday life. So in science, a fact is the truth. It is something that can be verified. It happens, that is it. We can verify that it happens. Going back to our gravity example, what goes up must come down. The apple, when I throw it up in the air, is going to fall. That is a fact. Okay? So when we get into laws, science laws state what happens. Just what happens. Nothing else. Okay? The generalization about the way matter and energy behave results from inductive reasoning and repeated observations in written and verbal statements or mathematical formulas. They state what happens. 4 plus 4 equals 8. That is a statement of what. It doesn't tell you why 4 plus 4 equals 8, but it tells you it does. Okay, what goes up must come down. The law of gravity. It doesn't tell you why. It just says what goes up is going to come back down. So a law is just what happens. A theory, it's not this thought up little thing that is going on in your head that you think might happen. It's not what it is in everyday layman's terms. A scientific theory is an explanation of why something happens. Okay, so the law states what happens, and the theory states the why. Okay, so it's an explanatory statement or set of statements derived from facts, laws, and confirmed hypotheses. So these things have been tested and proved, and it is the why behind what's happening in our world. So this summarizes what we know, and it suggests directions for other studies. So remember, a law is what happens, and a theory is why. So some examples of laws and theories. The Big Bang Theory, not the TV show, although it's great, not the TV show. The Big Bang Theory is a theory that postulates that the universe began almost 14 billion years ago with a massive expansion event or a Big Bang. Okay? At this time, the universe was really, really small, and then suddenly, bang, and now it's huge. This offers an explanation of how the universe was created or why the universe exists. An explanation. Okay? That is a theory. The law of motion, or Newton's first law, it states an object at rest remains at rest, and an object at motion remains in motion unless acted on or acted upon by an outside force. So, this just tells you that something that's moving is going to keep moving until it hits something else. Or something that's not moving is not going to move until something else hits it. It doesn't tell you why. It just tells you this thing's not going to move until you hit it, and this thing's going to keep moving until you stop it. Doesn't tell you why, just what. So that's the difference between theories and laws.